Hi, it's Betsy Nicoletti. Thanks for joining me today. We're going to talk about the difference between an acute uncomplicated illness and an acute illness with systemic symptoms. We know that we can select a level of evaluation and management service based on either time or medical decision-making. And if we're using medical decision-making, there are three elements: the number and complexity of problems addressed, the amount of data to be reviewed or analyzed, and the risk of additional morbidity or mortality from additional diagnostic testing or treatment. Today, we're going to talk about just 2 bullet points in the first element, the number and complexity of problems addressed, even though we do know we need 2 out of the 3. So we're going to talk about an acute uncomplicated illness or injury, which is low in medical decision-making, or an acute illness with systemic symptoms. And we always want to remember that a problem addressed is counted when it is assessed and managed at the encounter. So it needs to be evaluated and treated at the encounter. It's not just sitting there in the problem list. So here's a chart that I put together that I think helps to differentiate between an acute uncomplicated illness and an acute illness with systemic symptoms. And first we start with the CPT definitions, right? Always a good place to start. So an acute uncomplicated illness, a recent or short-term problem. It's got a low risk of morbidity, so complications from this condition are unlikely to be there. There is little to no risk of the patient dying without treatment, and a full recovery is expected. Examples from the 2021 CPT book: cystitis, allergic rhinitis, or simple sprain. And we'll look at a couple of other examples as well. So full recovery is expected without any functional impairment. When we get to the acute illness with systemic symptoms, it can cause systemic symptoms and have a high risk of morbidity without treatment. Then the next sentence is a little complicated in the way it's written. It says, for systemic general symptoms like fever, body aches, or fatigue in a minor illness that we might treat because we're going to alleviate those symptoms or shorten the course of those conditions or prevent complications, see the definitions for self-limited or minor or acute uncomplicated. So that is, and now let's move your eyes back to the bottom, to the left-hand side under acute uncomplicated illness, to the bottom row. What that complicated CPT sentence is saying is, for fever, body aches, fatigue, malaise, in the conditions listed above, those do not constitute an acute illness with systemic symptoms. So the examples in the CPT book from 2021 were pyelonephritis, pneumonitis, or colitis. So you're going to say, why am I including examples from 2021? So CPT removed all the clinical examples. And you remember, we even had clinical examples in the back of the book before we had the new guidelines. I'm not sure why. Maybe because there weren't examples for every single specialty. So here are the examples again from 2021 on one slide. And here are some examples from the American Academy of Pediatrics. And I use these because it's often pediatricians who are saying, if I have a patient with otitis and I give an antibiotic, doesn't that give me a level 4? So their grid, the American Academy of Pediatricians, has under acute uncomplicated pharyngitis, viral illness, viral syndrome, simple sprain or strain, allergic rhinitis or conjunctivitis, and uncomplicated otitis. They're examples of what would, for a systemic illness, would be moderate, this acute illness with systemic symptoms, a strep throat presenting with fever and vomiting, pneumonia, or recurrent otitis with fever and perforated TMs. I thought it would be helpful if I looked up the 3 conditions that are listed in the 2021 CPT book as acute illness with systemic symptoms. First, I made a column for the symptoms related to the system. Then for unrelated symptoms and morbidity risk, and pay real attention to the morbidity risk. Pyelonephritis, if not treated, could have lasting damage to the kidneys or could become a bacterial infection. For colitis, the symptoms, the unrelated symptoms, and the morbidity risk, colitis can cause life-threatening complications, dehydration, perforation, or severe bleeding. And pneumonitis can cause permanent lung damage if it's not detected or treated. So the risk of morbidity is significant for those three conditions. So when you're auditing a note and you're thinking about where to put it in low or moderate in the number and complexity of problems addressed, look at the CPT examples and compare it to the condition that you're auditing. Is it more like the examples of simple strain or sprain, conjunctivitis, viral illness, or is it more like pneumonitis, colitis, pyelonephritis? Look at the risk of morbidity related to the condition, and then that one-page chart that I have on slide 4, look at that, and I think that will help you to differentiate between those two. Thanks for joining me today and watching this video. We do have other brief videos on YouTube. And of course, if you're a Coding Intel member, you can watch all of our brief and long videos. Thanks very much.